The SUMMIT trial is a study of Bezuclastinib, which is a highly potent and selective KIT D816V inhibitor, small molecule, for patients with non-advanced systemic mastocytosis, so indolent and smoldering. And this is an ongoing trial. This drug, as I just alluded to, is highly potent, highly selective. So it spares the off-target kinases. So you don't have, or at least you shouldn't have, off-target side effects like, cognitive toxicity or intracranial bleeds, which can be relevant, for example, with avapritinib at high doses. Now, what we're talking about now is really the indolent and smoldering trial. That's the SUMMIT trial. There's also the APEX trial, which is advanced systemic mastocytosis. Now, in indolent and smoldering patients, avapritinib is dosed at 25 milligrams a day, extremely safe, and therefore, in this setting, perhaps some of the safety advantages that I just outlined may be less relevant. But with Bezuclastinib, what we are seeing is that the efficacy is very impressive, as are the reductions in markers of disease burden. So the part 1 is done. The dose has been identified. It's a 100 milligram of the optimized formulation once a day. And now we are in this placebo-controlled phase, the results of which are awaited, where over a 6-month time period, patients are randomized to placebo or Bezuclastinib, just the way the pioneer study of avapritinib was done. And then the readout is really what happens to their symptoms. There is a proprietary symptom score called the MS2D2, which is used to capture the symptom benefit.